Scarlett, thank you so much for coming on today.
Thank you for having me.
No, I think obviously we met kind of initially over social media because you're massive on social media. And I think what's super interesting about you is you'd be the last person someone would suspect of having not one, but multiple chronic illnesses. And on top of that, someone would look at you and think you're a high fly. You're on social media, you work for a very, very well-known radio, channel. So yeah, it's going to be super interesting. But I just want to go back to the beginning, kind of, let everyone know a bit about you and who you are, where you come from, that sort of stuff.
So I feel like I'm going to have so much to say while I'm here because, as you mentioned, I've now got 3 chronic illnesses, which unfortunately have also caused other conditions off the back of them. And I've learned very quickly that one chronic condition snowballs into the next and then the next. And before you know it, you've got a whole host of conditions, basically. But the first condition that I started to talk about publicly, which is one that I'm really excited to talk to you about today, is chronic UTI or interstitial cystitis, as some doctors and patients like to refer to it as.
Chronic UTIs, I didn't realise this, but every time I've done a post on it or spoken about it, the amount of comments about people suffering about, and I think it's a perfect storm where doctors traditionally on the NHS don't really know much about it. And it's actually the patients, like you, that know way more. And there's only a few centres. So I think the combination of both makes it like such a topic that everyone wants to know about. But yeah, go back. Let's go way back. When did all this start? Like, what, if you can remember, what was your first kind of starting symptom you ever had?
So I actually remember as a kid being the kid that got cystitis a little bit. So I remember being a little girl and drinking too much orange juice, and then it would burn, and I would cry that it was burning when I was going for a wee. But my main issues started, to be honest, the moment I became sexually active, and I think that is a key player for a lot of UTI patients, especially women. So I started to get standard 3 or 4 day long UTIs when I became sexually active. Not really a big deal. Most girls deal with that. You take a short course of antibiotics and it's gone. But unfortunately, at the age of 22, I got a UTI whilst on holiday, and I thought I'll be home in 3 or 4 days. So obviously I'll wait till I get back, see my GP, and get the nitrofrantoin that you always get. And by the time I got back and got my appointment and got my nitro, realised it was suddenly a very different story because my symptoms didn't go away and they basically never went away. And that was the start for me at the age of 22, the start of my chronic UTI. And I don't know whether it was the short delay for me not accessing the antibiotics as quickly as I normally would, or if it was just completely random, but suddenly that infection just decided to be the one to change my life, basically.
I just want to touch on that point because I think it's very important, actually. And I think it resonates with a lot of people, and a lot of people might be in that situation. So going back to that time when you're on holiday and got the urine infection, talk a bit more about that, like your symptoms. What were they? The treatment that you tried, and what kind of carried on, and what were the symptoms that manifested? So
for me, UTI would always manifest as like a burning pain. I know that it does manifest very differently for a lot of patients, and some people will have a UTI and hardly have any symptoms, and some are doubled over in agony. For me, an acute UTI at onset, it would be extremely painful to wee, and the reason I want to define that is because I don't want to say think, I know that acute UTI pain is completely different to chronic UTI pain, especially for me. The symptoms are different. It's not the same. So acute UTI would start with really painful urination, feels like weeing glass, essentially. You're like, literally like, you're tense, it's that painful. It burns when you urinate, it burns after. You might have a lower bellyache, you might have a lower backache. It's quite intense. I feel like it's a very intense, high level of pain that you can't switch off. Whereas my chronic UTI pain, I have no pain during urination. It was actually slight relief for me. It was any second that I wasn't urinating that was painful. If it had stayed like just urinating pain, it would be different. But when it's constant, that's when it's life-altering. So I think as the infection evolves and changes, and as we now know becomes embedded, as we're saying, in the bladder wall, it changes the symptoms for a lot of patients.
That's really interesting, because I think even a lot of doctors, it's hard to distinguish between what acute or chronic is based off your symptoms. So you were saying when you had the chronic UTI, it would be when you were passing urine. That's when you'd have...
That would be the most painful bit. There would be pain in between. But actually with chronic UTI, the pain would be when I wasn't urinating. It was every other second apart from on the toilet. I actually found passing urine a slight relief. But then again, I have friends that are patients with chronic UTI that find urination really painful. So I think every single patient is slightly different.
So yeah, going back to when you were 22, was it? I'm guessing you came to your GP, they gave you the antibiotics, did the urine culture, which I'm guessing was positive, which is not always the case, but we could touch on that in a second. And then you were given antibiotics. And then what happened after that?
So I actually have access to my full medical records now. So I've been back to that exact test and I've got the culture, the results. It was Enterococcus, which is my main enemy in life. I know it's E. coli for a lot of people, but for me, Enterococcus is the bug that I really hate, that I have trouble with. So I think I was given 3 days of nitro, which is standard. I then went back on the fourth day and said, my symptoms haven't gone this time. Can I have some more? And then obviously they dipped my urine. And at that point, because I still had nitro in my system, my dip was negative for leukocytes and nitrates. And now, fast forward all these years, I'm someone that dips my urine at home constantly. I have been hospitalised with UTI before with a really high level of bacteria on my cultures with no leukocytes or white blood cells. So actually, I think that when the infection becomes chronic, you can't trust the dipstick. Some of us don't have a high level of leukocytes with infection. It's not that... What's the word I'm looking for? Sorry, migraine brain. It's not that accurate.
Yeah, at all. I agree, and I think it's a very important point to know, especially on dipsticks, which is what even to this day people kind of base that, if you got UTI or not, which is wrong. I think there's a study. We talked about Professor Ali earlier. He said there's a study that's like, if you've got symptoms, that's almost 80% accurate.
Yeah. But the problem is that I went back after the initial nitro. I'm testing negative on a dipstick. So at that point, they won't send for culture because if the dip's not positive, they won't culture. And even if they send it, apparently the lab will bin it because they say there's no need for us to go to culture. There's no white blood cells present, therefore no infection. I now have so much evidence in my trusty folder that I've had such a high load of bacteria at times with no white blood cells because my body doesn't give that initial immune response anymore like it should, I guess. Yeah,
no, it's super interesting because actually, so the culture level is, I think, is 10 to the 5 of white cells. And the crazy thing is that was based off studies they've done in the 1960s on pregnant women with pyelonephritis, which is a really, really bad infection of the kidneys, right? So that threshold's up here.
Why have we not reduced the threshold or redone that study?
I don't know. You think his CAS was great, right? It's been a long time since 1960, but we still use that. And good question. I don't know. So even if you don't meet that criteria, it doesn't get or near that criteria, it won't get grown out. So therefore, you're not going to get a UTI and maybe not get treatment. So, but yeah. So let's say So you went to that set of antibiotics. You realise it's not a normal UTI because you had continuing symptoms. So talking a bit about what was that like, that period in your life? I'm assuming you were very busy because you're early 20s.
Yeah, I was trying to live my life and I went back asking for more antibiotics and essentially was refused. The dip was negative, the culture's not being sent away. So, give it a few more days, it will just be inflammation in the bladder, it will calm down. And the weird thing about chronic UTI and embedded UTI is that the symptoms kind of go up and down. So there were periods of time where I thought, it is getting better. I'd have a couple of days where I'm like, it is actually a bit better. And then bam, you're hit again really hard. And suddenly it's like, oh God, I need to go back to the doctors. This is really bad. But obviously the day you go back and they dip, your symptoms aren't so bad, or you've drunk so much water because you're in pain that the sample is actually really diluted, which now I know is not great. But I started to get this kind of weird low burning pain that just started to increase in frequency. So I noticed, first of all, in the evenings, I'd start to get ready for bed and I'd start to get this really heavy burning pain, and it would get so bad into the night, I basically stopped sleeping. Then I got referred to a urologist at my local Spire, went to see them. They did loads of tests and said, we don't know why you've got these UTI symptoms. You haven't got UTI. They did cultures privately and so on and said that there was no infection. But during this time, this went on for months, I was continuously fed more 3-day courses. When the symptoms flared badly and I was quite irate, they would chuck 3-day courses at me. So it was constantly on, off, on, off, on, off. I would feel better on the 3 days, off, symptoms spiking again. So now in hindsight, it's obvious. I was responding to the antibiotics because it was an infection, but because of the tests, and I don't know why, and I apologise if I seem really negative towards GPs during this, but my experience is really bad. And I think that across all 3 of my conditions, my life would look a lot differently now if my GP had actually listened to me. It was obvious that I had an infection, but because GPs, even neurologists, are so set in stone with these damn dipsticks, why can they not see that if I'm improving antibiotics, it's clearly an infection, despite what that dipstick says?
I mean, I can try and answer that a bit being a GP. I mean, I think it's multifactorial. And I think it's clear. Like, I'm going back, and also people, firstly, going back on the point where you're having sort of 3-day antibiotics. One of the concerns that a lot of people have is about antibiotic resistance. However, the perfect way to build antibiotic resistance is by giving you a short course of antibiotics.
On and off.
The bug lives on it, and that's literally the perfect way. What would be better is giving you, which you should have happened in hindsight, is giving you just a longer course. And the reason why doctors may not do that, in particular GP land, I think is, again, the perfect storm of there being guidelines there, them only having 10 minutes to see you, them not knowing you at all, and all those factors being like, okay, look, let's give you 3-day antibiotics. It's the safest thing to do. That's going to make sure that I don't get sued, if something goes wrong, which is not the right thing to do in your because clearly if somebody stepped away and actually looked at your history, they were like, hang on a minute, this poor patient needs more antibiotics. She's obviously responding to them, despite the test being negative. They're negative because you've got antibiotics in the system still. So I think that's where I'm not excusing it, and it still happens to this day. The guidelines still haven't changed. We're getting there, but the tests are still the same. The 3 antibiotic rule is still there, and it's still very rife amongst most clinicians. I'm not saying that's not right.
There hasn't been any update on that, and I'm sure we'll come to that later because a friend of mine yesterday went to GP with a clear UTI that she's let simmer for a week, right? So she's ignored the symptoms for a week, even though I'm like always in her ear. Don't do that. She's been after a week. They've given her 3 days of nitro, even though her main symptom right now is back pain. And I'm like, the infection is already like, nitro's not going to treat you if it's moved up. But anyway, you can cut that. It's infuriating.
I think these frustrations. That's why I think is getting you on as a patient, as a very well educated patient on this condition is very important because. Otherwise I wouldn't see the whole side of the story, and I think it's super important. But so going back to you, obviously you had 3 days recurrently. For how long did that go on for?
It went on for about 6 months. So I got referred to this local Spire urologist, and I'm actually really grateful that after doing so many cultures and prodding and poking and ultrasounding my bladder and emptying and then ultrasounding again, I wasn't retaining. That's never been an issue for me. But they go through the whole protocol. He did a cystoscopy and was like, your bladder is extremely inflamed. He said it actually looked like a menopausal bladder. And at the time, I didn't really understand what that meant. I kind of understand that a bit more now. And he said, I'm going to hold my hands up here and I'm going to refer you to another urologist in London at St Mary's. And that was Professor Kular and Dr. Fernando's team. And I'm really grateful that he did hold his hands up and say, I'm not sure what to do with you, but I know that this team over here are doing something really great with infections. I'm going to send you there. Obviously at the time I was like, I don't want to go anywhere else. Thank God he did send me there because I would never have known about this team of urologists. So I went to Professor Kular and Dr. Fernando and they literally took one look at me and said, you're going to go on long-term high-dose nitro for 6 months and let's see how you get on. And I had gone from that point not sleeping. I was literally suicidal. I was in the bathroom 8 or 9 times a night. I was sleeping in 20-minute blocks. I'd become so physically and mentally exhausted. I looked ill. I was like, how am I meant to live my whole life like this? Like, it was insane. Like, the mental toll that UTI has on you, it's just such a jarring pain. I describe it to people like toothache. That's the only other pain I can describe it to be similar to. It's not like backache. It's not like any other muscular pain or anything. It's like, I'm doing this. That's the only way I can physically express the type of pain it is. You can't switch your brain off to it. You can't sleep. You can't anything. So by the time I got to Dr. Fernando, I was so desperate. He put me on antibiotics and literally within a month I was a different person. Like the improvement in me after a few weeks, it was like I went from 10 out of 10 pain, 2 weeks later, 9 out of 10, 2 weeks later, 8, and it just got lower and lower. And I was like, how frustrating. That's all I needed basically that whole time.
Yeah, look, I what you said there about the pain, I mean, even for example, me, I should know in it, but when I even have a sore throat, I can't think about anything else, right? When you're ill, you're like, oh, it's a sore throat. So just, not just even lots of chronic pain conditions. Living with that must be so difficult. But I'm guessing that put all your education, your work, everything on hold. What, like, were you able to still function during the time?
Yeah, it's weird. I guess I have a really high pain threshold because I got used to it, and I'm quite a determined person. So I won't let anything get in my way of what I want to do. I mean, it's a different story now with vestibular migraine, but we'll get to that. I did manage to do a lot, but I think what's really sad is I look back at everything that I did and I achieved, and I have this shadow of sadness because I will look back at a holiday picture like, oh my God, look, there's me in Las Vegas, or there's me riding a horse here. And my first thought in every single picture I can show you between the year, I don't know, well, I'll look on these dates, is I was in pain then. I was in pain then. I remember that day, I was literally peeing glass. Every single memory I look back at, I can tell you exactly how much pain I was in that particular day because I can see it in my face. Like you can't hide it. Like it changed me as a person, I think.
Yeah, I just can't imagine living that much amount of pain, you know. And it's crazy because I think people think of UTIs as it's not that serious, you know. It's just a urine infection, you know. Have some antibiotics and go away. But I think, you know, you're saying that, you said really eloquently that it's not the case.
No. I think I should probably add, I managed to do so much because my pain was really intense burning pain. The exhaustion was the worst part because I couldn't sleep because my symptoms spike at night. But for a lot of other patients that have their main symptoms as frequency or urgency, it's harder for them to do things because they need to be physically on the toilet more. That wasn't so much of a problem for me in the early days. That became a problem later on. So then I physically couldn't go out because I couldn't be away from the toilet. But it was just the burning that was the main issue for me initially.
So you know, the professors, you know, was it Kula and Fernando, you know, saved your life, as I say, until 6 months.
So grateful.
Within 1 month, it was, you know, and this was high dose antibiotics every day, right? What happened? Was that the end of the story? All happy days?
No.
Or was it, no?
So I've actually made a timeline here, which you'll see me looking down to if you're watching this on video. So 2015 April was when this started, and I was diagnosed initially as interstitial cystitis.
Oh, really? Interesting. Was that after the NHS urologist Spire one, was it? Or
yeah.
Okay, after you did cystoscopy. Because I thought
once you've had a few negative cultures and a cystoscopy that doesn't show anything sinister, you're instantly slapped with the IC label. When I got to Dr. Fernando and Professor Kula, they were like, this is actually a long-term embedded infection. They tried to explain it to me back then, but I didn't really understand what they were saying. So I just said, okay, I'll take the tablets, and off I went. So antibiotics kept me stable for 5 years. So from 2015 to 2020, I was pretty good. The problem was that I weaned off them. And I see this with a lot of patients. Some patients respond really well to high-dose antibiotics. The second they come off them, they're back to square one again. And that is what ultimately led to me getting fulguration, because I went through this cycle a number of times until I had been on and off a few times and realised that I couldn't live on antibiotics any longer because I've now got other conditions, but I also couldn't live in the pain. So then I was forced to make that massive decision, which we're going to get to later on. So what happened was I was 5 years stable. I made the mistake of weaning off. We reduced to a slightly lower dose, and then I went on to nothing. And then I just went to antibiotics with sex, which I believe is something that I will have to do for the rest of my life, regardless of how minimal my symptoms are. Sex is a risk for me. It's my main trigger, and it doesn't matter what prevention, hygiene, probiotics, supplements that I take, it's a problem for me. And that's just the way it's always going to be, and it's not worth the risk. So I will always be a prophylactic antibiotic after sex girly. That's just who I am, basically. So
well, there's nothing wrong with that. I just want to touch, because I know you said you had enterococcus, but E. coli, for example, doubles every 20 minutes. So we know that if you get a slight onset of symptoms, or you know you're going to get a UTI after intercourse, that having that will definitely make a difference.
Yeah.
But yeah, sorry, Karen, you were about to say something. I just wanted to get that in there to make sure that people would be like, oh, I know that.
I went through the whole, finally off antibiotics, doing really well, and it was like a ticking time bomb. I got another massive infection as such, and I couldn't seem to get that one under control with the nitro like I had before. I went straight back on high dose and it wasn't really responding as well. So actually Dr. Fernando and Professor Kula were like, let's have a look at your bladder, because they hadn't done my first cystoscopy. It was done at the Spire. The local urologist did that. And I was actually in a lot of pain at that point. Like, things had gotten quite bad. And I remember saying to Dr. Fernando, I am in quite a lot of pain. And he was like, well, you seem all right. Like, he was like, but we'll have a look. And then I remember waking up in recovery and them saying to me, and I was not completely with it at the time, we had the whole urology team come down and look at your bladder. We've never seen anything like it. Like, it was that angry inside.
So this is after the antibiotics?
Yeah.
Okay.
And he was, after that, he was like, okay, we're going to give you a load of tramadol. And they were like, whatever you want, you can have. He was like, he said to me, there is no way that you are not in immense amounts of pain based on the way that I've just seen your bladder looking inside. I think because I was so chill about it before, but that's the life of a chronic pain patient. We are chill. We don't turn up at A&E shouting and screaming because we're used to being in pain. Like, we're chill about it because that's how we live. So anyway, I noticed that his kind of level of care intensified once he'd seen the inside of my bladder at that point, because he was like, this isn't good. Started me on pain meds. They put me on like an MCAS regime as well, which I would like to talk about a bit later. So the antihistamines.
Interesting.
I believe that my bladder issue is made up of a few factors, and for me it's infection, histamine and hormones. So we'll get to that. But I had that cystoscopy. I was put onto high-dose antibiotics again with the intention of starting gentamicin instills after I'd recovered from the cystoscopy. So a few months went by, started my gentamicin instills, and I was still on high-dose antibiotics for them. He said, let's keep you on them so I'm on oral. I think I was on doxy at that point and nitro as a combo. I was on the high-dose oral, and then I was having gentamicin and lidocaine instilled into my bladder via a catheter, which was extremely painful. A catheter shouldn't be that painful, but now I know, because I've got all that damaged tissue in my bladder, infected tissue, which we'll talk about when we get to fulguration. That insertion of the catheter was just going through that tissue and causing me absolute agony. Anyway, I had 8 or 9 installations, and it was going quite well, and I thought, I'm starting to see an improvement here. Maybe this was the right thing to do. And then they stupidly, I've said this to their face, you should never have done that, and I asked them not to, took me off of oral antibiotics. They were like, we can give your body a break now, you're doing really well, your counts are really low, you're not culturing anything, we can just stick with the gentamicin instills. And the second we did that, massive infection.
Despite the installation?
Massive infection. And I said to them, please don't take me off, I'm so worried, I'd rather stay on, I've got no symptoms or no worries about C. diff, I'm quite lucky like that. But they obviously still, even though they're doctors that prescribe high dose long term, the goal is to get you off as soon as possible, really. And they thought I'd be safe with the gentamicin, and I wasn't. So I then got a massive infection. It was E. coli and Enterococcus, highly resistant. I ended up in hospital on IV gentamicin for 2 weeks.
Wow, that's obviously the massive infection once you withdrew from the antibiotics.
And that is when I had my first vestibular migraine.
Oh, really? Interesting. So that exact time...
Yeah.
What was it like for you the first time? What was it?
Insane.
In hospital, was it?
In hospital. And I remember it was the second week of gentamicin, I remember laying in the bed and my eyes were rolling back, I was green, and my mum looked scared. She was like, help her. They were putting an ECG on me. I was like, the room's spinning, heart pounding, and they're like, can't see anything. And I literally was like, I feel like I'm going to die. Like, it was that bad. Now I know it was vestibular migraine, but at the time, nobody knew what was wrong with me. They said, it could be blood pressure related if you had some water. And I'm like, I've had low blood pressure my whole life. This is not that. Like, literally the room is spinning. So we can obviously talk about vestibular migraine later, but I believe that gentamicin... it's known to cause vestibular issues. It's a whole separate conversation. They thought that's what they thought I had ototoxicity. So I went through loads of tests. They were like, you've got gentamicin poisoning, it's damaged your inner ear. It was only when I went through all of them that they were like, actually it didn't, this is coming from your brain. And then I got sent down a whole new route of, you've also got a brain condition now. Yay. So then that was the next thing.
Okay, so we'll branch on that in a second. So okay, so chronic UTI, acute UTI turned into chronic UTI in the early 20s. Eventually put on long-term antibiotics for about 5 years. Fantastic. It got worse. Started your installations. had taken off the antibiotics, which obviously didn't end well, as you just said, then what happened after then?
I think that the installations was a bit of a band-aid for me. It was never going to fix me. I appreciate they didn't know what to do with me at that point. But when the installations failed and the IV gentamicin kind of got things under control to an extent, it just basically took me from acute UTI pain back down to my chronic UTI pain. I still had symptoms. I remember leaving Southend Hospital and within a week culturing 2 bacteria again and thinking, what the hell was that all for? That was all for nothing. I've just put my body through 2 weeks of hell, had this weird dizzy episode that I don't feel right from still, and I've still got the same bacteria I went in with. So at that point, I think it was obvious that I needed an intervention of some sort physically. I'd been watching YouTube videos, researching day and night, reading groups, reading other patients' stories. When you're a chronically ill patient, you spend your life researching it. Like, I put more research into chronic UTI than I did my actual degree, which was a really specialised science degree. Like, I put that level of research into this, basically. And I saw that there was a doctor in Turkey doing fulguration, which is basically removal of the bladder lining via, I don't know, what would you call the tool?
Yeah, it's like a diathermy thing they use. There's different types they can use. Like it's almost like it can be on. Just to add, like, fulguration for UTIs is a massively contentious topic.
Yeah.
So I appreciate you talking about it.
I should probably add as well, before that, my last ditch attempt before deciding to get fulguration, I actually did the Urimmune vaccine as well, which helps against 4 bacteria, 2 of which I regularly cultured. But I think the problem for me was, and it'll be obvious when I show you the videos of my fulguration, my doctor actually filmed the whole surgery for me so I could physically see what he was doing afterwards. And it's helped me to understand so much more what chronic UTI is doing inside the bladder physically. There is no way that installations, Urimmune, oral antibiotics were going to clear my infection, because it was a thick tissue, essentially, of infected tissue that antibiotics were never going to clear. So I got to a point where I was in so much pain. I had acute symptoms on top of my chronic symptoms constantly. Couldn't get off the toilet, couldn't get out of the house, doubled over in pain, shaking, sweating, fever symptoms. Like, it was ramping up and up. And I was like, I'm going to get to a point where I'm going to get sepsis. Like, this is bad. And I was like, I can't live like this. I was going back to that bad state of mind that I was in years before. And at this point, a couple of my friends had been for fulguration with this doctor in Turkey. So we chatted about it in our little bladder group that we've got on WhatsApp for a year or so, and a couple of them had been and had it done, and they'd seen massive success. One of them had a suprapubic catheter, and she'd been told in the UK that she would never, ever get use of her urethra back, and that she would need her whole bladder removed. And she went and had fulguration and now uses her urethra again. Catheter removed, a lot. Like, for some patients, it's life-changing. Not all, but for some, it is life-changing, and I'm one of the ones that is helped.
And did you inquire about it in England, or there's no one you could find doing it in the UK?
So I went to the. I should probably add that I'd also started consulting with Dr. Anderson as well at this point.
Oh yeah, fantastic! I know Dr.
Yeah.
She's
So
great.
even though I was with Professor Kula and Dr. Fernando for years, after the whole installation thing, I kind of was like, I need a break from this. And I needed a doctor that would listen to me when I would say, I only feel better on oral antibiotics, because they didn't listen, whip me off. And, you know, I don't resent them for it. They're doing their job. I get that. And I still see them now, and everybody's happy with where I'm at. But Dr. Anderson agreed with me that if I went and had fulguration done abroad, which was my intention, that she would culture me regularly when I got back to the UK and keep an eye on my healing progress, which was really nice, because I didn't want to come back and have no one monitoring me. Basically, it's really important to not get an infection in that healing process again. So I actually went to Dr. Fernando and Professor Kula's team in London, and I said, look, I want to go and get my bladder fulgurated. Will you do it for me? And they said, we only do it in the UK for bladder cancer. They said that a couple of doctors have started to do trials, and they've done 1 or 2 on chronic UTI patients, but it's not something that they readily offer. It's not available for everybody. So I said to them, I'm going to go. And that was it. And I went.
I don't, because firstly we touched on what fulguration is, but essentially we use it in cancer, where essentially they look inside the bladder, any abnormal looking tissue, they essentially burn it away, right? And then at the moment, the UK is just for cancer. What was that like? Because I think, getting that procedure done at the stage you'd got to, was it just desperation, or were you scared? Because especially the fact you had to go to a different country, right? What did that whole process feel like from deciding again to get it, to get the procedure done, to actually booking the tickets, flying out, the whole hospital experience? Because that is quite nerve-wracking, especially because I'm sure you've heard about the horror stories, right?
Oh, the whole Turkey surgery thing. I thought I was going to come back botched.
Yeah, so you hear that a lot, right? You don't necessarily hear about the good stuff, you know.
Do you know what, the plastic surgery issues with Turkey and Istanbul, it's kind of given other more credible surgery a bit of a bad rep, unfortunately, because when I say to someone, I'm going to Turkey, or I've been to Turkey to have major surgery done, my bladder has changed my life, they're like, why'd you go
They see me some sort of plastic surgery or something.
Yeah, like, why Turkey of all places? It just happens to be a coincidence that the doctor that is the most experienced in this in the world, I believe, is the doctor I went to. He just is in Istanbul. And obviously we're going to talk about it more in detail now, but from what he said, in Turkey, and I now know in Russia as well, fulguration is common for UTI patients. You start antibiotics, you start instillations. If that doesn't work within 6 months, you're going to have fulguration. Like, it's standard. It's the next step. It's the step after instills. Whereas here, it's not a step. So the interesting thing is that I went and had it done. Let's skip forward. I've come back. A year later, I have my first appointment with Dr. Fernando and Professor Kular again, because I have NHS appointments with them too, as well as privately. So there's always one in the pipeline coming up that I always attend, even if I'm okay at the time. And they were like, we haven't heard from you. This is the longest we've never seen you. Like, what's happened? They were like, are you okay? I said, yeah, I've had it done. I'm off antibiotics. I'm fine. And do you know what they said? We've started doing it. We've started fulgurating UTI patients. And I was like, obviously slightly annoyed, but then at the same time, like, I've done the right thing because I went to the expert. I don't believe that I would have got that result at that point in the UK, because the tool was different, and I think they're still fulgurating here. I know that Saatchi Mould is fulgurating as well, but I think it's being done more superficially still. And I think that my result was so good because the doctor I went to was so experienced. He wasn't afraid to maybe go a little bit deeper and go into the neck of my urethra slightly where the tissue was starting to grow down. They won't do that here.
What? Yeah. I think because I think it's brand new, and I think there are obviously risks which we talked about before. We'll talk about in a second. But obviously, for you, it's giving you big benefits. But what was the actual procedure for you like? Like, what was it like when you were going through it and after?
Yeah, sorry, I didn't answer you about the process. So, I had a massive like flare. It was like flare on flare, and I was actually away again in Dubai. It's always Dubai. I get really poorly. I think maybe I get dehydrated when I'm there, and it intensifies everything. But I was away in Dubai. My brother lives there, and it was just before Christmas, and we were flying back to the UK together for Christmas. And I woke up in the night from the deepest sleep, and I was physically screaming. I've never had pain like that before. I remember this one night, and I'll remember it for the rest of my life. It was like someone had put chili oil up my urethra, and I was literally in the toilet screaming. And I was like, that is it. I'd just been through all the gentamicin issues and thought I was getting better. At this point, I'm also dizzy, and now this intense 11 out of 10 pain. And I remember texting my mum saying, when we come home next week, we're going to get on a plane and go to Istanbul. I booked the flights. We came home for Christmas, and me and my mum got on the plane on Boxing Day. Wow. And I booked the flight the week before we flew.
So that was the last straw, that bad episode.
I don't know how I made that plane journey home from Dubai. I think I was in agony. I think I weed like 15 times during that 6-hour flight. Gosh. Like, it was constant, and I was in agony. And at that point, going every like 20, 30 minutes, I was like about to burst. It was that painful. So I don't know how. I think mentally, I couldn't have booked fulguration any further in advance than I did, because I would have talked myself out of it. So luckily I managed to get hold of that doctor, and he was like, I can hear the desperation in your voice. He was like, I'll do it before the new year if you can get yourself here. He was like, just get here, I'll do it. You're going to be fine. So I got there. I don't know how, because at this point I was in a wheelchair. My vertigo was so bad. I hadn't been diagnosed with vestibular migraine. I was just dizzy. No one knew why. I just couldn't walk hardly. I was dizzy. The room was spinning. My mum's pushing me through the airport in a wheelchair. We booked a hotel. We got to the hospital, and it was actually the most incredible medical experience I think I've ever had. And I never expected to come home and say that. So I got there, didn't have much time to talk myself out of it because it was just that 1 week. Obviously, I'd thought about fulguration loads before this, but I'd always, book it on. I'm getting a bit better now. I feel a bit better. when you've got a week and you're in agony, there is no going backwards. So we got there, and the first day that we landed in Istanbul, we went to the hospital. I had, this is insane, like, especially as a UK patient, I know people watching this will be like, what? I had, on arrival, a COVID test. I was met with a translator who stuck with me for my entire week and every appointment. I had a chest x-ray, a pelvic MRI, a pelvic ultrasound, blood tests, full physical health check within 2 hours.
Wow.
It was literally one after the other. With this, me and my mum were like, what is going on? So this translator woman, she was like, now we take you for MRI. And then literally she walked us out of that room, 2 doors along, now ultrasound, now blood test, now chest x-ray. And at the end of them few hours, the last door was Dr. Savinch, the urologist.
Wow.
And he sat in front of me with his folder of all the results that had just been done. And was like, yep, no diverticular, how do I say it? Diverticulitis, is that right?
Diverticulitis, yeah.
Yeah, because he wanted to check all these things. He was like, I don't trust any of the NHS notes you're coming here with. He was like, I want to see everything myself. And he did everything. And then he said, okay, I want to fulgurate you tomorrow.
He said, Imran, who owns this hospital, if you listen to this is what we need to do. But that sounds amazing, right? You've usually got a one-stop shop for everything for you.
Yeah. And my mum was so nervous. She was like, where are we going? What do you mean you found this man on YouTube? What do you mean we're flying to Istanbul? Like, she'd never been to Turkey before. She was like, are you sure we're going to come back alive? Like, she was fully prepared for us to get to this weird hospital. It was like a hotel. It was swanky marble floor to ceiling. Like, it was beautiful.
We'll get on the procedure in a second, but what was your mental state like at this point? Because it seems like your journey has been like this. Like, you're doing amazing on the antibiotics, then you stop the antibiotics, and now
it's
like,
so
then you had a big episode. Like, what?
It's so mentally destroying when you go from getting things under control to things being bad again. It's so disheartening. And I think now that I've been ill for like 10 years and I've got multiple conditions, I cope better when things are bad, because I know there are going to be bad times. I think what's really hard, there's this really bad toxic positivity thing on social media, and that didn't help me in the first few years. And some people might turn their nose up at me and be like, oh, negative Nelly, blah blah blah. I actually find being realistic is more helpful for my mental state. So in the first few years I was like, positive thoughts, yoga, this is going to get better, Zen, this is trauma stored inside my body, I'm going to feel better one day. Just keep positive. Everyone kept saying to me, keep positive, it's going to go away, it's a UTI, it will go away. Actually no, because every time you flare, it's like you're breaking your own heart over and over again, because you're disappointed, you're back at square one. Now that I know that all 3 of my conditions aren't necessarily curable, they're manageable, every time I flare, I'm like, cool, this is crap, but it's going to settle again soon. I'm going to ride out this bad wave. I know it's coming. I know I'm going to have a bad spell soon because I've been good for a bit. Like, being positive about the situation rather than being unrealistic and breaking my own heart over and over again has served my mental health better.
So it sounds like you've come to terms with your conditions, learned to live with it, rather than just thinking, okay, I'm going to one day be miraculously cured, which I think's fantastic, right? But okay, so you've done these amazing tests. You said you're going to have the fulguration tomorrow. So how did that go?
I think the most nerve-wracking part was I was probably quite numb at this point. I was switched off. I was just trying to get... Because I remember being in so much pain that I counted down the days to fulguration. I remember that 7 days between booking and getting there. I remember being in bed at night in agony thinking, 6 more nights like this, 5 more nights like this is all you've got to do. Because if I didn't have that countdown, don't know where we'd be right now, because I couldn't count down.
Wow.
It was that bad. So I was counting down to the op day thinking it cannot get any worse than this. There is no way that I can be in more pain than I'm in now. The thought of a stranger that I found on YouTube burning my bladder from the inside out, to me sounded less painful than the pain I was in. So that's me trying to explain how painful it was at that point. So I know they say don't meet strangers off the internet, but he's my favourite internet stranger ever.
Seems to have helped you a lot. But wow, okay, so that...
The scariest bit, sorry, I should add, was being put to sleep. So going down for anaesthetic, and you know that moment where they're counting you down and you're in the room and there's lots of people and there's kind of flapping getting you into theatre, not being able to understand a word that anyone's saying, that was scary. They're all talking and I'm laying there thinking, what on earth are they saying? I don't know what's going on. Like, in the UK, it's okay, you're going to go down now and nice deep breath for me. I didn't know what anyone was saying. I remember thinking, this is absolutely terrifying.
I can imagine. At that point also, it's probably a bit too late to do anything, right?
Do you know what it's made me think? I love a bit of plastic surgery and, you know, getting little alterations done. I'm all for it. I can't imagine being in that position for a nose job or plastic surgery. That must be terrifying, because that not knowing who's looking after you, what they're saying on being in a foreign country, I can't imagine being in that position through any other position than pure desperation. Like I was. Like if I'd been laying there for a nose job, which don't get me wrong, I'd bloody love to. I can't imagine at that point being comfortable and thinking, oh my God, what am I doing here?
Yeah, I mean, I suppose some patients doing that may be desperate for various reasons, right? Because you know, physical appearance could have a lot of mental health.
That's what I guess I've worded that wrong. Like they must feel so
saying,
strongly about it.
But I see, I get your point where if you haven't really thought about it and you're not really sure whether you want the operation or not, and you're at that stage, you're thinking, okay, you'd be very scared, I imagine.
Yeah.
But thankfully for you, you went to sleep, had the fulguration done. Then what was your first experience waking up?
Do you know what's crazy is I woke up in less pain than I went to sleep in.
Really? Straight away?
I woke up immediately in less pain, having had my bladder burnt. I know that he did inject anaesthetic around the area and into the vagina and all around my urethra, so that probably would have helped. And I remember him saying that's going to wear off by such and such, you know, tomorrow at such and such time. No pain.
Wow, that's actually amazing. I don't think I've ever... Because after operation, sometimes you have anaesthetic, but pain kicks in quite quickly. You need to have...
That's the only
more
operation. That is the only operation I've had where I've woke up in no pain. I've had quite a lot of surgery. My second cystoscopy with Dr. Fernando in London, where they were like, we had the whole team come down to look at your bladder. I woke up in so much pain from that I will never forget that feeling. I've had my tonsils out, I've had wisdom teeth out, I've had loads of things. And there's nothing worse than waking up, you're coming round and all of a sudden it's like, bang, pain, you're awake. No. And I was so prepared for it and there was nothing. I woke up with a catheter in. So he wanted me to have the catheter to allow my bladder to heal for a good few days without filling and so on. And I was expecting that to be hell. It was fine. My first wee after having the catheter removed, painful, but fine. There was actually, I've never been in pain with my bladder since fulguration like the week before.
So remind me, when did this happen, this operation?
So fulguration was December 2021, so literally between Christmas and New Year. So
wow, so we're 2025 now, so that's a long time, you know, for someone who's had a chronic UTI.
Yeah, I haven't spoken about this and I know so many people have wanted an update, but there's a massive part of me. Obviously, I've been distracted by the other conditions that I've now got, which have taken over my life, but there's also a massive part of me, and I know that chronic UTI patients will understand this. You don't want to say things are good, because when you say things are good, they get bad. So there's like this jinxing element to it. So everyone's like, please, we need an update. And I'm like, I really want to tell people how amazing this has been for me and how it's changed my life and that I'm living off of antibiotics. But at the same time, I'm scared to preach the good news because then I might... But I've got to accept I might be back at square one again. That's probably going to happen.
And I think that's a great thing about you. I think you accept that, because I think a lot of people may not do that. And I think for the ups and downs of it, I think you maybe need to be prepared for a potential... I hope it doesn't happen, by the way.
Yeah, I think it will. And I'm honestly fully prepared for it. My biggest fear in life is, and I always say this to Dr. Anderson, I'm like, please don't ever die. Like, I can't, there's so few chronic UTI doctors, we can't afford to lose them, basically. Yeah. And my worry is, what happens if this doctor in Turkey stops practicing, or I don't know, but I have had small flares in the last 4 years, don't get me wrong. I've had periods where I'm like, oh my God, like, we've got to get back on that plane. But it's over within a few days, before I've even gone back on antibiotics. But I'd be ready to go back for round 2, 100%.
And and this is a hard question to answer maybe, but what is a normal, like for example in Turkey and Russia, you said, what have patients said there, like how often, obviously it varies very, you know, from person to person, but how many rounds do people often need? It varies, obviously, you might never need one again, right?
Yeah. So
which would be the dream, right? I'm assuming.
I'm in a fulguration group and it's got patients from all over the world in. There's a doctor in America that fulgurates quite regularly as well. And different doctors use different tools. The loop tool is more effective, but it comes with higher risks. I believe they're using the rollerball here in the UK. I'm not sure what Saturn Mould is using, probably the rollerball. The doctor I went to uses the loop. I think there's a doctor in America that uses the loop. But they can fulgurate deeper into the tissue, but then obviously the deeper you go, the higher the risk. There are a couple of patients I know that have had perforation, which is a risk, and you sign before you have even a cystoscopy or a biopsy that can happen.
I think it's important because I mentioned before that fulguration is massively contentious for various reasons, right? And one of them is because of the potential downsides of having it done. Because obviously the bladder is quite a thin wall, right? And on the other side of the bladder is, if the bladder ruptures, you can get really bad sepsis, which I know you had before, but it can be really bad. You have operations, long-term recovery. But so I think it'd be great for you. But I think, what were the risks you were told about? And did it, obviously it didn't put you off. But
I think at the point that I went, I didn't have any other options. I had, like, if you look at, we've already been talking for God knows how long. I'm not saying to you, I had chronic UTI for 3 months and then I went to Turkey and had fulguration. We're talking 2015 to 2021. We're talking 6 years in, and I've done Urimune, I've done installations, I've done high-dose antibiotics orally, I've done IV antibiotics. Where am I going realistically from there, apart from suprapubic catheter, which probably would have worsened my infections, to be honest.
Well, that was actually, you were actually thinking about having one of those, aren't we?
Yep, and end stage bladder removal. At this point, I was a 25, 26-year-old glamour model. How's that going to affect my career? Like, gosh, a bag of wee. Like, if it needed to get to it, I would have done it to get out of pain. Really? But thank God that I didn't make that decision and I did this first, because my attitude was, well, I can't be in any worse pain after fulguration. And if it doesn't work, then we'll think about bladder removal.
It's interesting because I mentioned earlier about the amount of patients who have reached the stage where they've tried everything. Even on social media, I'm not an expert in chronic UTIs. I know a lot about them, but this kind of, we've tried you also, we've tried the vaccine, we've tried long-term antibiotics. And by the way, long-term antibiotics are great, but what was your experience like on them? Because they don't always work for everyone in terms of, they work, but in terms of the side effects which they can cause, like affecting gut health, it can cause, vertigo, dizziness, making you feel sick, all these things. But what was your experience like on them?
I think that this is like part of the discussion that I was quite excited to have. Like, I think that the pros and the cons of long-term antibiotics and the other treatments are different for every patient. And I think the hard thing about chronic UTI is that all patients have slightly different symptoms and they all react slightly differently to all the treatment options. So what might work for one patient doesn't necessarily work for another. Someone might do really well on oral antibiotics. Someone else might instantly get C. diff. The next person might consider themselves cured from 5 installations. I've seen that. Someone like me, it made me worse in the long run. So, like, it's not a one-size-fits-all condition or treatment plan. So I've got friends that have had fulguration and it's changed their lives, like I mentioned, and I've got one that went and she is no better than before. She's exactly the same. But then that's a patient that also didn't see any improvement on antibiotics. So then it leads me to think, okay, we've got this IC diagnosis, which is an umbrella that basically means bladder pain. Let's be honest. It means bladder pain and we don't really know why.
Exactly that, yeah.
There, under that umbrella, I think there is chronic UTI, which probably accounts for, these are numbers that I'm speculating on, they're not real numbers, obviously. I reckon 80%. Because most people that have interstitial cystitis have it because they have a UTI that just didn't get better, or they had 3 days antibiotics and needed more. There's definitely a portion of patients that have hormonal interstitial cystitis symptoms, so it's a lack of estrogen maybe, or menopausal. There's patients that respond to histamine in the bladder. I think I fall into that category a little bit as well. As a child, orange juice, mummy, my wee burns. Now, champagne, instant, 3 minutes after having a glass of champagne, I'll be like, oh, my bladder's on fire. That is not infection.
Histamine release from
that is histamine. But I think there's all these different categories that fall under IC. There's another one I was thinking of earlier as well. I think I actually wrote it down. So there's also another massive area, which is pelvic floor dysfunction. So many people think they've got IC. It's actually pelvic floor dysfunction, which goes with pelvic floor therapy. So I think if you're a patient with IC-like symptoms, you really need to go away and research what falls under that umbrella and work out where you sit. I know that infection was a massive contender for me, undoubtedly, but I do also think that maybe pelvic floor dysfunction a little bit and histamine is an issue for me too. And I do get a little bit of burning around my period still, so I've probably got a hormonal element too. So it's such a complex condition. It's so hard, not just for the patients, but for the handful of doctors that are trying to treat it as well.
You said you talk about, because another MCAS, the mast cell activation syndrome, It's another one of those things that hit a lot of interest recently because it gives you loads of symptoms, right? A lot of people are suffering these symptoms. They think, oh, have I got MCAS? Which is a lot of the time a differential diagnosis. But it sounds like you're managing it by, I'm assuming, just cutting out the things that trigger the histamine release, right? But it's interesting. When did you get? Because MCAS even now is not. A lot of people don't still recognise it. A lot of doctors recognise it as a condition. So when was that sort of mentioned to you, and when were your kind of feelings around it?
Do you know what's crazy? When I first got sent to the London team, Dr. Fernando and
2015. Wow.
They actually said then, we think you've got a long-term infection that needs treatment. They also put me on famotidine. And I remember at the time, I wasn't an expert in chronic health conditions then on how much research you need to do. I remember picking up this box of famotidine and Googling it and being like, why am I on antihistamine? I don't know, take it. Now, all these years later, I do think I have MCAS issues because I'm having issues related to my POTS. And actually, everything's kind of grouping together. And I'm like, oh, okay, why do I have hives every time I have a shower? That's not right. Probably have got a histamine problem. And I think that based on the fact that fizzy drinks, orange juice, all of them things give me UTI-like symptoms immediately. It's not infection, it's immediate. That has to be a histamine response. I think that a lot of these chronic UTI patients fall into more than one of these categories, which is why it's so important to not streamline on obsessing with, is infection for me? Definitely. Have your cystoscopy, make sure you rule out anything sinister.
That's important.
Nobody wants a cystoscopy. It's awful. It's so horrible to have that
cancer. You've got to rule out cancer, right?
Yeah, but you've got to rule it out. It's a thing. It can happen,
yeah.
So I didn't want my cystoscopies, but I've had them. Great, because now I know it's not Hunner's lesions. I think that's how you say it. It's not stones or anything that could be causing a problem. And now I can go away and be like, yeah, I think this is infection, or I think this is MCAS. Then you can kind of pinpoint where to treat yourself.
So we could just touch on the MCAS quickly. We'll go back on the fulguration again in a second because I think there's still to talk about it. But with the MCAS, so yours was just bladder symptoms. You didn't have, and the hives, you said.
Bladder forever with the MCAS type symptoms. It's funny because when I met Professor Kulai, I remember him saying, I want to work out if you've got something called Ehlers-Danlos or an MCAS problem. I remember him bending my wrists. And I was thinking, what on earth has this got to do with my chronic UTI?
Okay.
Now, all these years later, I'm like, okay, I know exactly why he was checking. And I remember he said in that appointment, most people with MCAS or Ehlers-Danlos also have something called POTS. And I was like, I haven't got that. I do have it.
It's so interesting. I think they're all linked. I think
they are.
All these things, obviously then you've got fibromyalgia into the mix. You've got chronic fatigue, ME is another, all these things. We'll touch on that in a second, actually. I've got a few theories on that myself, but I want you to just speak to the young lady perhaps who's out there there's maybe two young ladies. The first one is out there who's had a UTI that's not getting better and is what you were like back in 2015 when you came back from holiday and you're still getting 3-day courses. What would you say to the, let's be honest, lady, potentially a man, but most likely a woman? What would you say to her and how to navigate what she's about to happen, which is 3 days for 6 months?
Yeah, I think it's really hard because you can tell someone what to say and how to advocate for themselves, but when they're being constantly met by the brick wall of the GP that won't prescribe more than 3 days, we can't really progress here. So I know exactly how I would want an acute UTI to be treated in the first instance. I've got a 16-year-old sister who's got her first boyfriend now. I am terrified because I kind of know what's coming. It happens to all of us. And of course, when the day comes, I want to be like, okay, you need a 2-week course of nitro, for example. She's going to get 3 days. She's going to get 3 days. And that's where the problem begins, because even if a patient can advocate for themselves, they're being hit by I can't prescribe for you. So I think if it were easier to get in with a chronic UTI specialist, if you've got this recurring issue, that would be the ideal situation. But I think if you're sexually active and you're prone to UTI, at minimum you should be supplementing D-mannose. It helps with E. coli infections. It's clinically proven. You take it non-prescription. Would love to get it on prescription, but we're probably years away from that. That can manage UTI for some people. There are some people in the bladder groups I'm in that say, actually, I came off low-dose prophylactic because D-mannose is doing the same without side effects. So I would say that anyone that's at risk, D-mannose should be part of your daily regime, and definitely around sex or risky activities, maybe swimming and other things that cause UTI. If you're recurrent, before you get to chronic, you should be taking Hiprex, even at a recurrent level, I think. I don't know how easy it is to get that prescribed. Some GPs are dishing it out like candy, and others don't want to prescribe it at all. I think it depends on your postcode, which is, again, another brick wall. I think that a couple of other notes that I've got here that I definitely want to mention is there are other conditions that mimic UTI that actually aren't even under the IC umbrella. But what I tell some of my friends that have problems with chronic vaginal infections, because we seem to have this massive misunderstanding in the UK that if you've got itching down there, it's thrush, go self-treat with thrush. Not necessarily true. Lots of people don't realise that they've actually got chronic BV. That's massive, massive problem that people aren't treating because they've not got the standard symptoms. They assume it's thrush and then they're treating the complete wrong infection. I think chronic BV is a massive problem for UTI, and it can actually mimic UTI symptoms. Then we've got the whole issue of ureaplasma, which it's like not even a thing in the UK. Like,
I must admit, I've only come across it very recently.
The amount of research I've done into ureaplasma, it can increase infertility rates. It can increase so many gynae problems. And what I've found is I've actually tested positive a couple of times to ureaplasma, is that when I've got ureaplasma, I will instantly have a vaginal infection with it. It almost enables the vaginal microbiome to be in dysbiosis so quickly. No one's testing for ureaplasma. Ureaplasma can be causing UTI symptoms, and you're treating with carmoxyclav or nitro doesn't touch ureaplasma. It has to be doxycycline and one other antibiotic. So like, if we're not testing for these things, how are we ruling them out of the equation, if you know what I mean? But there's no education on any of these things.
Interesting. So essentially, I mean, I as a doctor won't mind this, but I know some patients might say this is another big ball. I say it's essentially for people to advocate for themselves, and don't be scared to do your own research and ask your doctor about.
My whole life
could it be
is
this? Could it be
researching and advocating for myself and
Yeah,
demanding.
and by the way, I think a lot of people might disagree. I think you will probably disagree as well, which is fine. But I still believe a lot of doctors will still be willing to listen to the research you've done. And a lot of people say, "Oh, don't go and Google." Doctors will say, "Don't entertain anything I say if it's come from Google." But actually, I think if you've done your research and if you're a patient who is suffering, I think self-application is definitely a good thing, especially now when you can't really see a doctor.
Yeah.
When you
I think it is for chronic UTI because we've got a lack of doctors and a lack of knowledge. So actually, Dr. Anderson, she will say to me, "You are the expert here." She's like, "You are the expert, you're the patient. You know more than your GP or an A&E nurse knows about chronic UTI. So unfortunately, they're not going to like the way you talk to them, but you do know more than them." When I see my neurologist of vestibular migraine, it's a different... what's the word I'm looking for?
Interaction.
It's a different interaction because I don't know anywhere near as much as them as they know about migraine. But this area is something that it's kind of patient-led at the minute, I feel.
And then, so then the second person is at the end of their tether. They've done everything. So tried the vaccine, they've tried long-term antibiotics, which it's not agreeing with them, is giving them, potentially bowel problems. They've tried all the supplement stuff, D-Manos, hip protector, all that stuff. And they're thinking, okay, is fulguration an option? I know you're obviously very biased toward yes because it worked for you, but say if someone comes to you, what would be a balanced kind of response you could give them about whether they should consider it or not?
I think that fulgur option. This is migraine brain. Honestly, when I'm doing radio and my migraine's bad, I literally can't talk. I'm like, and I'm like,
are you okay?
That's aura coming in. I'm going to have a massive episode. No, it's fine. I need to keep drinking though.
Yeah, please do.
This is electrolytes. I'm just down them.
Yeah. We don't want to trigger anything.
Oh, do you know what? I kind of do need to have a bad day. They're going to monitor me tonight. I've been waiting for this for years. I'm like, what can I do tonight? Yeah. I'm going to run around that hospital room. I'm going to do press ups. I'm going to have a massive... Yeah. I think that fulguration is a perfectly reasonable treatment option at a certain stage of chronic UTI. I would not recommend, I don't think that, we're at a point like Turkey or Russia where, you've done 6 months antibiotics, you've tried an instillation, let's get you on the operating table. It seems to me at the point of first cystoscopy in the UK where they're doing that first initial check for sinister things, that's where in Russia and Turkey, apparently, if they go in and nothing sinister, but you've got that leukoplakia, that tissue, if they see it, they get rid of it there and then. Whereas here, they see it, they write it in your notes, and then they send you home. Like
They
it's
don't
in
do
all
it.
it's in all of my notes from my first cystoscopy, all
See
this
it.
tissue, and I'm like, so it's been there all this time. You could have just got rid of it, but they don't. So I think it will end up that's the case, that if they find the tissue, we will start fulgurating more routinely in the UK. I don't know how many years that's going to take, but we're getting there. I think we're heading in that direction. But I think if you've realistically exhausted all of these other options, I think it's an option. But I wouldn't recommend it unless you'd exhausted the other options.
Well, look, you've spoken very eloquently again about your experience, so thank you for that. And I think you've covered a lot about, I think your story will ring true with a lot of people. But before we go into the other conditions, I just want to say, what's your thoughts on, there's lots of active people, voices, doctors, non-doctors on social media in particular around chronic UTIs. And a lot of people tend to go to social media for advice or what to do next. And obviously we always say don't listen to social media, which I think is true. But in this condition of chronic UTIs, where some of the special people with the most knowledge will be patients, what is your view on all these, groups or, pages or people giving advice on chronic UTIs in particular, where doctors don't really have much knowledge on?
I think it's a double-edged sword, because I have learned more from other patients and patient groups than I have from most of my doctors. But at the same time, there's this level of hysteria in the groups, which I get. You see people taking their lives over this condition. It happens all the time, and it's devastating to see, because you know exactly how that person feels. You've watched that person post every week for 2 years, and suddenly their next post is, hi, this is so-and-so's family member, they've taken their life. And it's devastating, because we shouldn't be in this position. This shouldn't be happening. We shouldn't be taking our own lives because of a UTI that someone refused to treat because a dipstick was negative. It's absolutely absurd. But if you can use them groups in a healthy way to do your own research, if you're being prescribed something, you can go into a group and search that medication name and see what other people are saying about it. Helpful. Remember, people are going to talk badly about a medication probably more than they're going to talk about positively, because if they're feeling good, they're out living their life. They're not sat in a group catastrophizing. So it's a hard one. I've learned so much through the groups, and I've felt seen, and I've been heard and understood. But at the same time, with chronic illness, it's really easy to let it become your entire identity. And that's something that I have tried not to do, considering that all my conditions take up my every waking thought minute of my day. But I think you need to have that boundary with it, that you're your own person. Your journey is not going to be like that person's. If that drug didn't work for them, it might work for you. You've got to try it. So I think if you can use them in a healthy way, then they are really helpful. And use it to start your own research on what all of your options are. Don't be narrow-minded and stick to one thing. Open your mind and research all of the options available to you.
Yeah, that's a really good answer, and I think that's a really balanced answer as well. So that's good advice for people listening. So, okay, yeah, I think so. Thankfully, at the moment, touch wood, your UTIs are kind of controlled with, since the fulguration.
Yeah.
But you touched
I think I might have an issue around menopause, though. I've just got a feeling. Because I have this flare around my period, I'm already I can see where this is going.
Well, look, again, if it does happen, at least you're kind of almost mentally prepared for it. But
Dr. Anderson's already we'll get you on that HRT, vaginal HRT is ready for you. I'm ready now.
Yeah. But look, I think you're prepared for it. But look, I think you're interesting again because also I want to say, because you're in good from a UTI perspective now after fulguration, right? With the odd flare here and there, but nowhere near as bad as it was. But you mentioned one thing in particular when you had the gentamicin installations. You had your first episode of.
It was the IV gentamicin.
IV gentamicin.
Yeah. So in the bladder, I don't think there's any risk of gentamicin actually entering your blood stream, is there? So you don't have the risk of ototoxicity. Forgive me if I'm saying words wrong. Might be.
No, you said no. But that's when you had your first vestibular migraine, right?
Yeah.
So obviously your main priority was the UTIs, which is kind of settled now. But it seems like, because even speaking to you today, you've mentioned it a few times, that your migraine seems to be the bigger issue right now.